On the occasion of Breastfeeding Awareness Month, we have with us expert doctor, Dr. Jisha Rajendiran, consultant gynecologist, East Coast Hospital, Pondicherry. Can you tell us why breastfeeding is so important for both mothers and babies?
Breastfeeding is very important for the babies, especially in the first few months of their life. It is because the necessary nutrients in the correct proportions, it is provided in the breast milk. That is one part. So baby will be getting enough all the necessary nutrients through the breast milk. That is one part. And the second thing, the essential, the colostrum, or the first milk which is being secreted immediately after the birth, it is called colostrum, which is very, very rich in proteins which will help the baby for immunity. Why immunity is so important is baby won't have its own immunity. So the mother will be providing immunity through the breast milk with the contents which will give baby the immunity, so that baby will be protected from a wide range of diseases, and baby acquiring a disease in the first few months of.
What is the ideal duration of breastfeeding? For how many months should a baby be breastfed?
It's not actually the duration. When to initiate, that is also very important. So we encourage all the mothers to initiate breastfeeding within the first hour of birth, wherever possible. In all uncomplicated deliveries, it has to be initiated within the first 1 hour for full benefits. And exclusive breastfeed, that means baby is fed only on the breast milk, not on any other food. Exclusive breast milk is recommended by all health advisory committees, including WHO, for the first 6 months. And it can be continued even after baby is being introduced to other food supplements. We can still continue the breastfeed for the full benefit, possible up to 2 years.
That's wonderful. How would you describe the current breastfeeding scenario in India?
In India, majority of the mothers and their families are well motivated for breastfeeding. They're aware of the importance of breastfeeding, and we are generally seeing breastfeeding is initiated. But the problem, even though there is enough awareness, in India, we see that around 60 to 65% the babies are only given the so-called exclusive breastfeeding. The problem is they are not able to sustain the breastfeeding. Maybe it is a multifactor, multiple causes are there for that. Most common is maybe mother is not having enough nutrition or time, and some other religious and social factors also plays here. But the people who are continuing exclusive breastfeeding are still, we have to work towards that to reach some more good percentile.
What are some of the major challenges that mothers face, and how can they be addressed?
As I mentioned before, our population is generally well motivated for a breastfeeding. So the thing is that during the 9 months journey in pregnancy, at 1 or 2 sessions, we have to make the family, not only the mother, the family, aware of the importance of breastfeeding. Maybe a group session or individual session, depending on the hospital protocols or practices. It is very important to introduce the concept of breastfeeding and the importance in the pregnancy period itself. And treatable, correctable causes of, there are some causes which we can detect in the pregnancy period itself, some like inverted nipple or flat nipple, where we can give the corrections couple of weeks ahead of the delivery. All those things we can, by making the family aware in the pregnancy period itself, we can to some extent we can troubleshoot. And continuously, when the baby is delivered, the mother has to be under supervision, where mother is able to hold the baby properly, whether the baby is in the correct position. The word generally we use is latching. Properly baby is taking the breast and feeding, sucking properly. All those things can be monitored by the health workers, so that the mother is also having.
Thank you, doctor, for this valuable insights. Any final message for our listeners?
Yes, it is all of our responsibility to make a healthy generation. So the responsibility starts not only from the individual, it's from the family and the social responsibility. So the awareness has to be given in the pregnancy period itself, and the family has to be taken into confidence. And during the awareness, the family also should have the awareness. And as a team, we can work towards it. And whatever medical help, I think all the hospitals are equipped with lactation consultants and support team. So make use of it. We can conduct awareness camps, and I think it's already being done in India in a beautiful way. So just we have to introduce the term and the importance during the pregnancy period itself, so that mother and the family is very familiar with it, and unnecessary anxiety can be ruled out, can be reduced.
Thank you, Dr. Jisha Rajendiran, for your message.